back pain, fatigue, changes in digestion. Most people over 40 chalk these up to aging, stress, or lifestyle. But what if these everyday discomforts were warning signs of something far more serious? Colorectal cancer is quietly becoming one of the fastest-growing threats among adults over 40, and it often hides behind symptoms that seem harmless. The truth is, many early signs of colon cancer are subtle, vague, or mistaken for other conditions like hemorrhoids or irritable bowel syndrome. That's exactly why this video could be one of the most important you'll watch this year. We're not here to scare you. We're here to show you what to watch for, how to recognize the signs early, and what to do next. If you've experienced unexplained fatigue, digestive changes, or even slight bleeding, don't ignore it. The earlier these signs are recognized, the higher the chances of successful treatment. Throughout this video, we'll break down the symptoms with clarity, real examples, and tools you can use to assess your own risk. Subscribe now and turn on notifications so you don't miss life-saving insights like this. Your health and your future could depend on it. When bowel habits shift noticeably and persist for more than 2 weeks, it's not just an inconvenience. It could be a signal that something more serious is developing. These changes may involve how often a person has a bowel movement, the consistency of the stool, or a new and frequent sense of urgency. Such symptoms, especially when they last beyond the occasional digestive upset, should never be dismissed as normal. Colon tumors can disrupt the natural rhythm of intestinal contractions, a process known as motility. As a result, stool may move too slowly, causing constipation, or too quickly, leading to diarrhea. This altered motility creates noticeable shifts in bowel patterns, and in many cases, these changes are the body's way of flagging a deeper issue within the colon wall or nearby structures. Consider someone who's always had regular, predictable bowel habits. Suddenly, they are experiencing unpredictable timing, unusual stool shape, perhaps narrower or ribbon-like, and a newfound urgency that wasn't there before. These signs, although subtle at first, can develop into consistent patterns that warrant medical investigation. A practical step is to become familiar with the Bristol stool chart, a tool that classifies stool into 7 types based on shape and texture. This visual guide is often used in medical consultations to help track bowel changes over time. For individuals noticing persistent shifts, comparing with this chart can offer useful context and reinforce the importance of seeking clinical evaluation. The presence of blood in the stool, whether visible or hidden, can be one of the earliest and most overlooked signs of colorectal cancer. When blood is visible, its color tells a story. Bright red typically suggests bleeding near the rectum or lower colon, while dark, tarry stools often indicate older blood coming from higher up in the digestive tract. Both warrant careful attention, regardless of quantity or frequency. One of the greatest risks lies in the tendency to dismiss minor bleeding. Many assume it's due to hemorrhoids or temporary irritation, but that assumption can delay a much-needed diagnosis. Even occasional spotting should prompt a discussion with a healthcare provider. The earlier this signal is investigated, the better the chances of catching and treating the underlying cause. To better understand what's happening internally, it's helpful to visualize the colon and rectum as a system of interconnected segments. Bleeding can occur at various points, and its appearance outside the body depends largely on the location and speed of transit. Anatomical diagrams can offer clarity, helping patients connect symptoms to their possible origins. For cases where blood is not visible to the naked eye, a fecal occult blood test, FOBT, can be a valuable screening tool. It detects hidden blood in stool samples, often before symptoms become obvious. Regular FOBT screenings, especially for those over 45 or with risk factors, can play a crucial role in early detection of colorectal cancer. Abdominal pain that persists without a clear cause deserves careful consideration, particularly when it becomes a recurring part of daily life. The location of the discomfort can offer important clues. Pain in the lower left side may point to the descending colon, while discomfort in the right side could suggest involvement of the ascending colon. Recognizing these zones helps connect symptoms to possible underlying changes. It's also essential to distinguish between functional pain, such as that caused by irritable bowel syndrome, IBS, and pain rooted in structural or pathological issues like tumors. IBS-related discomfort often fluctuates and is relieved by bowel movements. In contrast, pain from colorectal cancer tends to be more consistent and progressive, sometimes accompanied by bloating or a sensation of fullness. Over time, cancer-related pain typically evolves. What starts as mild and occasional may become sharp, more localized, and increasingly disruptive. Some patients report pain that worsens after eating or becomes more prominent during certain times of the day. Creating a timeline of symptoms can help both patients and physicians detect this escalation and take appropriate action. Visual timelines can be particularly helpful in tracking the development of abdominal discomfort. Mapping when pain began, how it has changed, and what other symptoms have appeared alongside it can reveal patterns that are easy to miss otherwise. These patterns often lead to earlier and more accurate diagnoses. Tenesmus is the frequent sensation of needing to have a bowel movement, even when the rectum is already empty. It's more than simple urgency. It often feels like incomplete evacuation or constant pressure in the rectal area. Many people describe it as frustrating and disruptive, especially when no stool is actually passed despite the effort. This sensation is often caused by a partial obstruction or irritation in the rectum or sigmoid colon. When a tumor or inflammation affects this area, it can trigger signals that mislead the body into thinking there's stool to expel. These false signals can be persistent and uncomfortable, even interfering with daily routines or sleep. It's important to distinguish tenesmus from ordinary urgency. Urgency is the rapid need to find a restroom, often linked to loose stools or diarrhea. Tenesmus, on the other hand, is more chronic and less productive. Understanding this difference helps patients describe symptoms accurately and encourages physicians to investigate the structural causes more closely. A helpful way to understand the mechanics is through visual animation of bowel movement physiology, showing how a tumor might distort the normal passage of stool and affect nerve signaling in the rectum can make the concept of tenesmus much clearer. This type of education empowers patients to recognize and report symptoms that might otherwise go unnoticed. Persistent fatigue that lingers without an obvious cause may be more than just age or stress. It could be a signal of iron deficiency anemia, often related to chronic blood loss from a tumor in the colon or rectum. This type of fatigue is different from normal tiredness. It's more profound, affecting daily function and mental clarity. Anemia reduces the oxygen-carrying capacity of the blood, making everyday tasks feel unusually draining. In colorectal cancer, this blood loss may be slow and internal, unnoticed in the stool. Over time, the body's iron reserves deplete, leading to low ferritin and hemoglobin levels, critical indicators of how well the body is oxygenated. One of the key characteristics of this fatigue is how quickly energy diminishes. Patients often describe starting the day with some energy but feeling exhausted after only minimal activity. Unlike the kind of tiredness that improves with rest, this fatigue is persistent and resistant to recovery, making it a particularly disruptive symptom. Tracking energy levels over time and comparing them with iron studies, especially hemoglobin, ferritin, and serum iron, can help identify anemia before it becomes severe. A visual timeline showing the progression of fatigue alongside lab values can be a powerful tool in understanding the underlying causes and prompting further investigation. Losing more than 5% of body weight over a period of 3 to 6 months without dieting or increasing physical activity is a potential red flag for colorectal cancer. This type of weight loss isn't just about dropping a few pounds. It often signals that the body is struggling with something deeper and more systemic. Cancerous tumors place high metabolic demands on the body. As they grow, they consume nutrients rapidly and alter how the body uses energy. This can result in both muscle loss and fat depletion, even when appetite remains unchanged in the early stages. Over time, appetite usually begins to fade, amplifying the weight loss. In addition to increased energy demands, colorectal cancer may also impair digestion and absorption. Tumors can interfere with nutrient uptake or cause inflammation that weakens the lining of the intestines. These changes not only reduce calorie absorption but can also contribute to feelings of early fullness and chronic gastrointestinal discomfort. When weight loss is paired with fatigue, changes in bowel habits, or anemia, it becomes an especially urgent sign to investigate. Medical documentation of weight over time, along with a nutritional assessment, helps physicians track this pattern and identify whether the underlying cause might be malignant. Anemia that develops without any visible signs of bleeding is often overlooked, yet it can be one of the earliest clues to colorectal cancer. This form of silent anemia may manifest through vague symptoms like persistent fatigue, pale skin, shortness of breath, or a rapid heartbeat, even in the absence of blood in the stool. Colorectal tumors can bleed slowly and consistently over time, enough to deplete iron stores without producing noticeable blood in the toilet. This chronic internal loss gradually lowers hemoglobin levels, reducing the blood's ability to transport oxygen. The body tries to adapt, but over weeks or months, the symptoms become more pronounced. A key step in uncovering this type of anemia is the complete blood count, CBC, along with iron studies. Low hemoglobin, reduced mean corpuscular volume, MCV, and low ferritin levels are hallmark indicators of iron deficiency. These markers help doctors determine whether the cause is dietary, inflammatory, or due to hidden blood loss, including a sample lab report breakdown, highlighting values like hemoglobin, hematocrit, MCV, and ferritin can help patients understand their own test results. This clarity empowers people to ask better questions and advocate for additional investigation when anemia appears without an obvious cause. Colorectal cancer is increasingly being diagnosed in adults under the age of 45, a shift that challenges long-held assumptions about who is at risk. Many younger patients delay seeking care because symptoms like abdominal pain, rectal bleeding, or changes in bowel habits are often attributed to stress, hemorrhoids, or irritable bowel syndrome, IBS. This misattribution can lead to dangerous delays in diagnosis. Because younger adults are less likely to be screened, early warning signs may go uninvestigated until the disease has progressed. By the time a proper diagnosis is made, the cancer is often at a more advanced stage, making treatment more complex and outcomes less favorable. Raising awareness among both patients and healthcare providers is essential. When someone under 45 presents with persistent symptoms, especially those that don't improve with typical treatments, it's critical to consider colorectal cancer as part of the differential diagnosis. This approach could mean the difference between early, curable disease and a life-threatening delay. Advocating for earlier screening, particularly for those with a family history or high-risk factors, is now a growing public health priority. Sharing data on rising case numbers and encouraging people to push for more thorough evaluations can help shift the standard approach and potentially save lives. Join our channel's members club to stay ahead of the curve. Get exclusive content, early access to videos, and practical tools to protect your health and the health of those you love. Every symptom your body sends is a message. Some whisper, others shout, but all deserve your attention. The biggest mistake is waiting too long or assuming it's nothing. Colorectal cancer is one of the most treatable cancers when caught early. That means your awareness, your action, and your voice could literally save your life. So here's your next step. If you recognized even one of the signs we covered today, don't brush it off. Talk to your doctor. Ask for the tests. Share this video with someone over 40. This isn't just health advice. It's a personal wake-up call. Like this video, subscribe, and turn on notifications so you never miss crucial updates. And if this message struck a chord with you, leave a comment below. Your story might inspire someone else to take action before it's too late.